Welcome, everyone. This is our May Capital Chat. Thank you for joining us on a Thursday. This is a little bit of a change for us, a Thursday at noon, but we're glad you're here. And we are going to talk today about wrap up of the legislative session, a couple things going on at the federal level in Congress, and then some action items that you can take over the summer and through the fall too. And we will continue to have chats. Our next chat is in June, and then I believe we skip July. Is that right, Amy? Yes, and we'll be back in the fall. So if you consider August fall. So again, thanks for joining us. And I'm going to turn it over to Amy, who's going to lead us through our recap of this year's legislative session. Take it away, Amy.
Of course, I just started hitting buttons and now everything's, I can't, hold on just a minute. I can't get out of what I was in. That's what happens when I keep hitting buttons. Hi, everybody. I'm glad that we're all together and session is done. As you know, sometimes it goes a little bit longer. And we've been in session in June, so that's never fun when the birds are outside and farmers want to get back in the fields. But fortunately, we were done pretty much on time this year. And so, as Carlin said, we're going to kind of quickly go through some of the highlights of the legislative session, maybe the lowlights. And you might recall that Carlin had kind of, after one of the funnels, had grouped some of the things that had happened in sort of different categories of good, the bad, the ugly, the disappointing, the confusing. So I kind of am continuing along on that. But I also wanted to, Carlin and I kind of talked about grouping these in under the priorities of the council, and to see how much progress or little progress was made this year in accomplishing some of those goals. And I know these goals are pretty broad and are things that all of you have talked about on these capital chats in the past. So I'm going to go through the good first, because let's start out with the good. This year, we did see a $13 million increase in Medicaid funding for behavioral health. So mental health is $10 million increase, and substance use disorder treatment is $3 million. So they kind of combined those into a $13 million increase, which when you match it with federal dollars, that's actually more like $35 million. Some of that was accomplished because of the work that HHS has done in benchmarking the rates. And that means they looked around at what Medicare pays, what other states pay, and kind of compared Iowa rates to that. And we were pretty far down in comparison with other states, in particular like Nebraska and Missouri, who had just raised their rates. So that was good news. They also increased rent subsidies for individuals who are living in the community and are receiving HCBS waiver services. Those funds ran out last year, and I'm told this is about half of what they would expect to need to get through the whole year. So it's still not enough money, but it is an increase. So we'll have to watch how far those funds go this year. We've talked a lot about guardianship and conservatorships. And one thing that we've seen is that there is a big backlog in requests for public guardians for those that don't have a family member or an individual to provide those guardianship services. So they increased that pretty big, $500,000. So that makes the whole program 1.5 million. So that's a 30% increase in that. Also, they continued on their commitment to MHDS regions, mental health and disability services regions, by increasing their funding to 6.5 million. And you'll remember they switched to fully state funded and had a promise to go up to a certain level over the next few years. So this would be about $40 per capita, so 121 million total. So $40 per person by population in each of those regions. And that'll continue to go up next year too. When you look at an inclusive and accessible community, it's a little harder to quantify or do something about. One thing that legislators did was they exempted waiver homes from these really complicated facility-based requirements. So they require healthcare facilities to have these expensive sprinkler systems in them, and we're treating waiver homes in the same way, instead of treating them like you would another home where you'd have other safety measures. So this, by exempting them from this this sprinkler requirement, will really bring the cost of getting homes in the community. I've been told that it's $800,000 to $1 million to put these sprinkler systems in to some of the older houses. So that, as you can see, that would really bring down the cost of making homes available in the community. And also the legislators passed a resolution designating March Disability Awareness Month. So we kind of talked about that as a step toward being inclusive is understanding individuals with disabilities. And then on reducing, eliminating waiver waiting lists, there really was nothing happening this year about it, that in particular, but they did, let me backtrack. Last year, the legislature used federal dollars to increase home and community-based services rates, waiver rates, and buy down some of the waiting lists. They used federal dollars, and they have enough federal dollars to get them through 3/4 of the year, but they're left with 1/4 of the year, that 3-month period, that they could not continue those without state funding. So that's what you're seeing here. It's not really taking more off the waiver waiting list. It's just continuing what we did last year. So as you can see, that gets us through 1/4 of the year, 3 months. Next year, when the legislature comes back, they're going to have to fully replace those dollars. So over $20 million is going to be needed just to continue those services at the current level. But there were no additional dollars to buy down waiting lists this year or get rid of them. So Carlin also had a promising section, and Carlin, feel free to break in anytime you want to add anything, but we had some bills that were introduced and didn't make it through this year. One did, but we find them promising for different reasons. As you can see, there's a couple of things to try to get more services to individuals with autism. So one is to create an autism waiver, which legislators did not want to move forward on because HHS is reviewing waivers now. And so they're looking at making some changes there. So legislators were pretty hesitant to do anything with waivers this year until they know what HHS might recommend. In addition, there was another bill that we really hoped had made it through, was House File 243, which got rid of the insurance limits, so age caps and limitations on benefits for autism coverage. That did pass the House, but it's stuck in the Senate right now. So that has an opportunity to start up again in the Senate next year. It'll become alive next year, and it starts where it ended. So that's, it's halfway through the process already. Another promising thing, and again, fell into that not wanting to do anything with waivers, is increasing the individuals, the intellectual disabilities waiver, so that the benefits under that for home and vehicle modification are the same as brain injury. So for instance, the ID waiver only paid for $5,500 total lifetime for those, whereas the BI waiver, brain injury waiver, paid for $6,500 a year. So you can see that's a major benefit change there. It's not that expensive. It was less than $1 million. I think it was $695,000 to do that. So not an expensive change, but would be really impactful for people. And there was another bill that didn't move that would have required insurers to pay for maintenance and repair to complex rehab wheelchairs, which are quite expensive and quite expensive to repair. That didn't make it either. And we have the bill that keeps getting introduced every year that would make sure that direct support professionals don't have their wages taxed, so they wouldn't pay any state tax on their wages. That's just one other way legislators were trying to figure out how to get additional benefits to direct support professionals. You can also see there's a couple of other things that happened in terms of inclusive communities. I don't know why it's hard to pass something that says if you have an apartment building that's more than 2 floors, you have an elevator, but that didn't make it anywhere, but it was introduced. Another bill would have required communities to have van accessible priority parking, not just accessible parking. And then one thing that did pass, and we think it's promising, is that the MHCS regional governing boards were rebalanced, and providers now will get to vote along with the people served. In addition to having a person from the courts and a person from law enforcement added to them. They also limited how many supervisors could be on it to 49% of the board, so that they don't have the overwhelming majority on those boards, that the people served and the people providing the services in the community have more of a voice than the elected officials. That's controversial depending on which region you live in. And then promising also is this MCO tax that happened. They're going to take $44 million of MCO dollars. They're going to pay a tax. The state's going to give it back to them, but they're going to match it with federal dollars and keep the $100 to $120 million it brings in. They do this with hospitals and nursing homes too. It's just a way to generate additional money. And that's about the number that we continually hear from HHS that will need to be reinvested in community-based services after the next Department of Justice consent decree. The one that says we're in violation of the ADA and what we need to do about it. So giving people choice in the community is going to be a big theme this next year. And I only highlight that because I think we all should be saying that money should be reinvested in the community, because $100 million is a lot to ask for in the legislature. And it really could move the needle in doing that. So the disappointing and the confusing, I kind of lumped them together. Don't have anything on waiver waiting lists because they didn't do anything on waiver waiting lists. I get that. I guess that in itself is the disappointing part. But also, you've all heard about the public assistance reform bill that created asset tests, a whole household asset tests for the supplemental nutrition assistance program, or SNAP. That's food assistance. They will now be looking at everyone living in the household and what they own. And if that equals to more than $15,000, it would likely create issues with their eligibility for the program. They might lose food assistance. So that's really concerning. Also, they added some new identity verification, kind of like when you have a bank account or something and you have to have a mother's maiden name or answer a challenge question like that, or have a PIN number. They want to have something like that. You verify that. And they made it so that you don't have to do it online. You can do it through a caseworker, or somebody else can help you get that done if you don't have access to a computer. But then they're also going to do a lot of database checks that they may or may not be doing now. And in that process, they think that about 8,000 people with Medicaid, 600 kids on the Children's Health Insurance Program will lose services. 2,800 will lose nutrition services. There's a lot of people that may get lose access to Medicaid or their other services that they get, whether or not they really are eligible. It could just be an administrative error. But one of the things is you only have 10 days to respond if there's a problem. So that's something we're going to be watching. It doesn't have to be fully implemented until 2025. So there is some time. There's probably going to be some phasing in, but it is something we're going to be keeping our eye on, and probably something that's going to be sort of a something we have on each of our capital chats that we'll just check in on that to see if anybody knows anything more about it. Also, they added $8 million to create a new public assistance modernization fund. So what they're doing with that, it's money from a settlement that they got with one of the managed care companies, Centene, which is Iowa Total Care. They were paid $44 million because of some bad pharmaceutical billing practices. So they used 8 million of that to improve their system so that they can start this no wrong door entry system where you go in and you can find out what all of the services you could apply for and apply for them and determine your eligibility all in that one place. So it's only disappointing because it's tied to the public assistance reform, because that will be the way they do all these additional asset tests and verification. But there is a silver lining in the fact that they're trying to create it so it's easier and user friendly for people. So I guess it's maybe in the confusing section there. Also, nursing homes got a $15 million increase when HCBS services did not. But they did put a 1-year pause on new nursing home builds, so a moratorium on those. And it's just disappointing because we need to be, I think all as a state need to look at putting more dollars into community-based services that are outside of the more institutional levels of care, like a nursing home. Then the disappointing on inclusive communities, I broadened that to just be inclusivity in total. And one of those is, sorry, I have allergies today. I will have them all spring. The Health Policy Oversight Committee, I know some of you on here listen in on those. That it's a good opportunity to get more information about what the MCOs are doing and what HHS is doing during the summer months in the fall, when we kind of lose touch. And those are required right now to have 2 a year. They've kind of gamed that system by calling the morning meeting 1 and the afternoon meeting 2. So it's really only 1 day, but now they don't even have to meet for a day. It's just optional. And they also have public comment during those. So it's a good time for people to be able to check in. The other thing that I know Carlin worked on really hard at the end of the session was House File 716. It came out late at the end of April and it passed fast, and it requires the Iowa caucuses, so the presidential caucuses, to be in person. If you've been listening to the news, you might have heard that the Democrats wanted to do a mail-in presidential preference form so that people didn't have to take off or find transportation on a Monday night to attend in person, that their voices could still be counted. That will no longer be allowed, at least as they say that, have written it. And it also allows parties to put in more restrictions. So we've heard the Republican Party is looking at requiring somebody to be a member of the Republican Party 180 or 170 days ahead of time, like 3 months ahead of time or more than 3 months ahead of time. And you know that there are a lot of no parties or independents and that might want to switch over and have a choice and make their choice noticed. So that might not be possible in doing this. So that's kind of concerning, confusing, disappointing that they would limit access to individuals who may have transportation, childcare, work, or other conflicts. Quickly now, public transit got a third cut, which is disappointing. That's the only state dollars going into public transit, and they cut it by a third. And that is for infrastructure, but obviously the other dollars that are used for operations are going to get cut if they can't if they're gonna have to use those for infrastructure too. And then I added in limited property tax growth. They had a big property tax bill and have now said cities and counties are gonna have to can have a very limited growth between 2 and 3% annually. I note that because they cut public transit, they've cut other funding sources for things in the community. It may affect services like public transit if they have no ability to increase taxes to be able to pay for other improvements in the community, whether they be sidewalks and curb cuts, or if they are a park and wanting to make that accessible, or a library or post office. I guess that's a federal requirement, but anyway, that's why that's in that category. As property tax homeowners, you might think differently of it, about it not being disappointing, but then I have these. I am going to put these up on our website, so you have all of this. So if you if we don't cover it completely, but I would just make 3 notes that under these, we feel like there were a lot of missed opportunities this year for inclusion, whether it's government reorganization, where the deaf and blind community did not feel like their voices were heard when they made changes to the School for the Blind and the Department for the Blind and the School for the Deaf and Hard of Hearing. They were very clearly excluded. And then they were excluded again when they came to testify because they didn't have the ability to have the interpreter seen on the Zoom, and they didn't have the ability to really make comments when they should have been able to. I also think that we all need to pay attention to the boards and commission bill that House File 566 that the House passed, but it didn't get through the Senate. That is something that I think we're all going to be seeing next year, is throughout state government, eliminating boards and commissions, combining them. And I think a lot of the comments that were made during the subcommittee process on this was, you're watering down our voices. So I think that's something we need to watch. It also got rid of per diems, like travel expenses for people that serve on these, and gave them the option for virtual instead, which is fine. But sometimes people need to be in the room together to talk about things. So those were missed opportunities. There are plenty more, but those were the highlights. I won't go through these, but there are a lot of terrible voting bills that were introduced, and next year is a presidential election. So I would guess that we're going to see more of these, and we'll continue to fight them as much as we can to make sure that voting is accessible and that people are not unfairly targeted in the name of voter security. Last few things, we do think the guardianship bill is going to pass next year. We just ran out of time. And then Representative Josh Turek introduced 2 really interesting bills that I think that individuals should work on over the summer if they like them. One is to make sure that Medicaid covers safe catheters. I can't remember the chemical that's in the cheap one, but there's one that causes cancer, and the rates of individuals that use those catheters for bladder cancer are way much more, statistically more. So that is something that you might want to look at. And then also the Work Without Worry bill, which is modeled after some other states that allow people to really be employed to their fullest extent as possible, so they can earn money and continue to get the Medicaid benefits and other benefits they need to make sure they can get to work and live in the community. So that is one bill that I think legislators caught them off guard and are curious about. So curiosity is a good thing when you capture a legislator's curiosity about something. So last but not least is we feel like there was a big fail on supportive environments for students with disabilities between the AEA cut, which was almost $30 million this year. Some of that was because of the educational savings accounts. They did not really consider special education and what this would do for students with disabilities by allowing these private school scholarships. And then on top of that, then they added the cut to the AEAs. They also stopped providing Braille and accessible services. The Department of Education did. Now each district must pay for it on their own. Previously, the Department of Education paid for it and the Department of Blind did it. Now each district is going to have to pay on their own. There were some positives. So the bill that passed 2 years ago, Lead K, which stands for Language Equity and Acquisition for Deaf Kids, was increased. Well, not increased. It's the first appropriation for it. So it's $200,000. I know they wanted more, but it's a good start for a program that just got started last year. The transitional scholarships for the college programs for students with disabilities passed the House 95-0, and Carlin and I had good conversations that it was in the budget, but the Senate didn't pass it, so it got pulled out of the budget. This is a great opportunity to provide funding scholarships for kids that are going to these programs. Right now we have one at the University of Iowa and one up in Northwestern, and it really helps offset the cost of those programs. They're very expensive, and you're not eligible for other college scholarships for these programs. So we're hopeful for next year on that one. We've talked a lot over the years over the schools that are seizure prepared, making sure somebody knows what to do and has a seizure plan in place and how to administer and react to a seizure. Passed the House again, didn't pass the Senate. You're seeing a trend here. Same with the excused absences for kids that are receiving autism treatment. Some schools are calling them truant and sending sheriffs to their parents' houses. Heard that from a family member in Dubuque that testified. Again, passed the House, didn't pass the Senate. And then there's a bill that would integrate curricula or studies about people with disabilities and include anti-bullying messaging in that. That didn't move at all this year. So I'm going to stop talking and let Carlin maybe talk about this, and I can click on that and show you what it looks like on the Action Center. You want to
Amy, maybe we could open it up and see if there's any questions before we move on to the federal stuff.
I will go back.
And feel free, everybody, if you want to put a question in the chat, if you could give it while we're talking, feel free to do that too. I know Brooke asked if the public assistance bill has been signed up by the governor, and it has not. So there's still time to contact her and let her know your thoughts on the so-called SNAP bill.
And we should let people know that we also did write a letter. The DD Council did write a letter to the governor asking her to veto that bill. And you guys could do the same.
And also, if you're just interested in kind of general statistics about the session, there were 115 days that the legislature met. And in that time, the Senate passed 201 bills. The House passed 248, and both chambers together passed 172. So as you can see from Amy's very comprehensive list today that we talked through, a lot of them today, and there are a lot of legislation and policy that's being considered or moved through that affects people with disabilities. So far, the governor has signed 84 of those, and that was as of 2 days ago. So one in particular that we are very concerned about, and that came up late in the session because it was in the budget, in the education budget, and was the numbers in the budget were not revealed until the last few days of the session. In fact, the education budget was considered by, subcommittee in the morning, the committee in the afternoon, and then move to the floor of the House the next day. So when the cuts to AEA funding were revealed, then we didn't really have time to make comment or get any action alerts out to talk about what the effect of this could be for students with disabilities, students who have special needs. And so our only way to approach it now, if we want to get this stopped, potential for getting it stopped this year, is to ask the governor to do a line item veto of those funding cuts to the AEA, which is not out of the question. And we've actually heard that there have been some Republican legislators who were opposed to this, even though it did pass, because everybody wanted the budget to pass. And there are some who have questioned why the cut was made. We have not gotten any answers. There's no good answers to why we're cutting funding for AEAs when the needs are still there. The needs are going to potentially grow with the potential for more students to go to non-public school, because the AEAs still have to serve those students. So they will receive less funding for servicing those students because of the educational savings accounts that parents can use to send their students to non-public school. So there is a potential for the AEAs to have more needs and less funding. And so the cut just doesn't make any sense. So this could affect kids with special needs, especially in rural districts. So if you feel moved about this topic, send a message to the governor and let her know what you think about it. And we are doing that. And we have seen others who have been, including some Democratic legislators, who have asked for this to be removed. And we'll also keep an eye on this, and this will probably be part of what we work on next year too. So we've set it up in the Take Action Center for some issues that are top of the list right now. And please click there and see, and to easily contact the governor and make your voice heard. And it always helps to add your own story to the text that's already there, even if it's just a couple lines about how this affects you or your family. You have the opportunity to do that. I see we have a question from Kimberly. So would that money then go to the districts? Clicked off as I was reading it, sorry. So would that money then go to the districts themselves by request?
No, so they get their funding by formula the same way that the schools do. So it's a per pupil, per student amount. So when that amount going to public schools is reduced because of the educational savings accounts, then they get reduced. And then this bill, they have a standing appropriation, which means it's automatic. Okay. And so the reason we can ask for a veto of the cut is because the only way you change an automatic appropriation is by putting in that you're going to pay them less. So by taking out the section that says you're going to pay them less, you revert back to the standing appropriation. So usually we can't veto a cut because that means you're vetoing all of their money. But in this case, it's because one of the sources of their cuts is modifying, changing the standing appropriation to be less, we can actually veto it and have it result in going up. So it's a weird funding mechanism. It's not going to take out all of the cuts, but it will take out one of the biggest unexpected one that they had this year. So we're using similar messaging to what the school boards and the AEAs are using. And that's kind of why we voiced it the way we are. I had another question about what the real impacts of this are, and we don't know. We just know that it's a big chunk and AEAs have a lot of responsibilities. And we know that they have to do special education, so we're not sure what that means for the other services they provide. I think everybody's trying to figure that out right now, and this is what happens when you don't ask people before you do things at the Capitol. You get unintended consequences, and I think we're going to see that. But
And
one, yeah,
sorry,
go ahead.
they said that they will have to cut staff, was their answer. So go ahead, Amy.
Yep. No, that's what they, yep. So I hope everybody that's concerned about this can go in and express your concern. It's a very real possibility that she could do this. We have not overspent our budget, so they can afford to have, I think it's 20 million go back into it. So,
Okay. We want to move on to talk about federal.
yeah, go for it.
Yeah, I mean, still, if you guys have questions, please feel free to put them in the chat too, but we'll move on to talk about some issues going on at the federal level, which you probably have heard that we have a problem with our debt and the debt ceiling being at a point where it needs to be raised in order for our government to pay the bills that they've already incurred. And there's a fight going on in Congress about how that's going to get done. And so what has been proposed is to cut funding to entitlement programs as a way to leverage getting support for having the debt ceiling raised. And that would include Medicaid. It has also been suggested Social Security, Medicare, and there was actually a bill introduced by one of our congressmen, Zach Nunn, who wanted to protect veterans benefits and also Medicare. So to protect elderly and veterans from getting any cuts in case the debt ceiling is not raised and money cannot be spent by the government. So there's been some movement to protect some populations, but nothing has been mentioned for protecting people on Medicaid or people with disabilities. So this is something that we are contacting our members of Congress to ask to look at this and make sure that that government doesn't get shut down and people who need benefits would be able to get them, and hopefully negotiations are made and on the debt ceiling, and this doesn't lead to the consequences that it could. Also, there's some other federal legislation going on that's actually good in the Senate that we will actually do some more detail on now that we're past the Iowa legislature. We have time to do a little bigger look at what's going on in Congress, and there's some support for eliminating Medicaid waivers and waiver lists, not waivers, sorry, waiting lists, and also a similar bill to that was introduced in the Iowa legislature about work and helping people with disabilities have opportunities for work and also have opportunities for direct care. So we'll provide more detail on that. Otherwise, we also had HR 2811 to talk about. And Amy, do you have details on that you wanted to mention?
No, just that's the compromise for the debt ceiling. And so we do have an action alert up on that as well that you can easily follow through with. I'll show you that in a second. But I also wanted to note that Just yesterday, Senator Grassley, Chuck Grassley, sent out his next 2 town hall meetings. And so those are a good opportunity to talk to him about those right now. We will always have, when we get those announcements, we put them on our calendar so you can always find them if others have plans in the community. And certainly if we've missed one and you know about it, let us know and we'll get it added up there. But we've flagged this as the top issue right now because it's something that's going to have to happen fast because of that June 1st deadline. So it's here right above the AEA one. And if you click on that, there's a pretty simple explanation, but then there's a lot more detail in the guidance over here about what's happening, you know, where we're at now. And then we have a basic message that you can use. And I will be honest, I borrowed that almost word for word from the ARC. So they are also doing that. And they have there will be an opportunity for you to use a hashtag, Medicaid Matters or Save Medicaid, for those, if you want to do something on Twitter or in Facebook. But we really encourage you to send these. I know we always talk about personalizing messages. That's really a state thing because our state legislators don't like form letters. Honestly, in Congress, they're counting. So you are a number on one side or the other. And so they don't mind form letters. They expect them. You can personalize it, but it's almost more important at this point, if you don't have time, just to click and send. Because it is really important on the federal level. The sheer number, the quantities are almost as important as the quality on the federal level at this point.
And thanks for clarifying that. I forgot that had included work requirements for Medicaid, and there was just some news out. I think it was a study from Pennsylvania about how work requirements actually cost state governments more than they save when we're talking about Medicaid recipients. So that might be something to look up if you're interested in that topic.
Yes. I will move on if I can. There we go.
We just had some action items and some information for you as you kind of move past our legislative session and into the summer and fall. To please consider keeping in contact with your legislator and definitely contacting them about any of the bills or issues or policy that we talked about today. It's great to have your voice heard, keep your name in front of them, so they expect to hear from you when laws are coming out, or maybe they would even turn to you as an expert in this arena for these issues that we discuss and that are especially affect people with disabilities in Iowa. So there are also some ways that maybe more organized ways that we could talk to our legislators about issues. And we have a couple of groups that are setting up town hall meetings this summer or early fall to invite legislators to talk about these issues and others, the ones that are most important to them. So you might hear more about those. But if you're also interested as a group or as a community to put together a town hall meeting, we would be happy to help you put that together. And we have grants available too that could help fund your expenses. So please get in contact with us or check out our website. It's listed there with the application and requirements. It's a great way to get a group together to talk about issues and invite legislators. They're usually very willing to come and attend those, especially if they're locally and that's their constituents who are organizing and bringing these issues to the forefront. And 2 events we have coming up for youth ages 14 to mid-20s, kind of young adults that are potentially going through a transition phase soon. We have a leadership academy that's online. It's a week during the summer, and it's half a day, a few hours, where we talk about leadership, advocacy, civic engagement, community engagement, just how to talk to other people, and then how to talk about issues that are important to you also. So that we're taking applications for that, and we also have a information session about it next week. To learn more, and that's online also and at our website. And then our Make Your Mark advocacy conference is in August this year, very end of August in Coralville. And we have some great breakout sessions lined up, and also we'll be having about half a day devoted to talking about public policy advocacy, as well as self-advocacy, and lots of fun, interesting topics, and hope you can join us for that. So again, more information is on our website. And I see Brooke just put the link on in the chat. And I think next up is our next Capital Chat is June 23rd. Again, we're back to Friday at 11 a.m. We will probably be talking more about federal legislation, what's going on, and hopefully we will not be having to talk about the debt ceiling again, and that will all be resolved. So everybody contact your member of Congress about that, and don't forget the governor if you would like to make contact with her about these issues of AEA funding and also public assistance. Or anything else. Any questions before we wrap up?
Feel free to raise your hand too if you don't want to chat. I will just, one last thing on top of what Carlin said. Now is like this is the perfect time to start talking to legislators. You don't have an election this fall, so they have more time. They're not in session. They tend to be nicer. They have more time. And also, it doesn't have to be, when you hear town hall, it doesn't have to be something very formal. I've seen people have a potluck picnic and just invite their legislators to talk to them. They have kids playing in the park, I mean, it's just do something fun with them too, if you want to. It doesn't have to be something stuffy or formal. Legislators like the ability to just connect with people and not feel like they are on a spotlight on them all the time. So when you're thinking about it, do something that's comfortable for you. It'll probably be comfortable for them. So
that's a good point. And even at our Make Your Mark conference in Coralville in August, we're inviting the local legislators to an evening activity where we're going to do adaptive games and fun stuff. So, it'll be informal and just a way for them to mingle and chat and meet people. So good point, Amy.
Anybody think of other questions? I know this was an odd time to meet. I think we were trying to avoid the holiday, and then I have a senior graduating, so we couldn't do it next week either. So.
Glad to accommodate you, Amy, because you've worked hard this session, and we really appreciate all of your work and all the detail that you give us, and all of these laws, policies, ideas, what's going on behind the scenes. Amy's got her hand on it, so we really appreciate it.
Thanks, Carlin. All right, last call. Everybody wants to go out and plant their gardens, don't they?
Yes.
I'm surprised my cat hasn't made an appearance here. She's crawling around. All right. Well, thank you guys all for joining us. We really, does that? Yep. All right.
Thank you, Maria. Thanks, everybody. Thanks for joining us. We'll see you next month.
Everyone.
Bye.